a global social innovator, is revolutionizing healthcare by putting nurses front and center. In small communities in 30 countries around the world, nurses take the lead. This model was also recently recognized at the World Economic Forum. Jos de Blok, founder of Buurtzorg, now joins us live from the Netherlands. Jos, thank you so much for joining us. You've built a large, not-for-profit global social enterprise called Buurtzorg, which means neighborhood care in Dutch. And you have some 10,000 nurses. How does this work?
Yes, we started in 2006 with 4 nurses based on an idea that we should create small teams of nurses who are responsible for taking care for elderly people who need care in the neighborhood. So that's what we thought. We make teams of around 10 nurses, and they should be able to organize everything themselves. And it became a big success in Holland. So we grew to more than 10,000 nurses in 10 years' time. And we got a lot of interest from all other countries in the world. What we have shown is that the patients are very satisfied about the care they get. The nurses are very happy about the way they can deliver the care because they decide everything themselves. They have no managers, no leaders in the team. They are just working based on their professional ethics. And very important, the impact on society is very big. We could show that by working this way, the impact on the coast led to a decrease of 40% less costs. The model became very popular in a lot of countries.
So why does this model of small community-led care, Jos, reduce healthcare costs?
Because when you have the autonomy to decide yourself as a nurse what to do, then probably the chance that you're doing the right things is much bigger than when you are part of a big bureaucratic organization. So nurses want to provide the best possible things. And what I wanted to show was that if you give them the right to decide themselves, and if they were able to deliver the continuity, not too many different people coming in people's houses, that it would lead to better results, better outcome.
And Jos, Buurtzorg is in more than 30 countries, including the United States, Japan, Australia, and Taiwan. And of course, Filipinos are known worldwide as nurses. They're in various countries around the world. How important are Filipino healthcare workers for Europe's and the global healthcare system?
Oh, I think if you look at the demographics in a lot of countries, you see that there will be a big problem with the capacity of nurses everywhere. So I think that if you look at the coming 10, 15 years, we see a decrease of young people coming into healthcare, and we see a big increase in people who will become older than 80. So I think there will be a scarcity of nurses in many countries. So I think that the Philippines and the Philippine nurses can contribute in the future in a lot of countries.
And does society, Jos, value nurses enough, given their critical role in saving lives and keeping us safe in this ongoing pandemic?
No, I think that a lot of countries are not valuing nurses enough. We have seen the last few years during the pandemic how important nurses are. And I had a struggle also in Holland with the government. But we decided 2 months ago to raise the salaries ourselves. So we said, let's give the example. And I hope that a lot of people will follow. So we raised the salaries significantly so that all the nurses will earn more the coming years.
That's right. Here in the Philippines, that's why a lot of Filipino nurses want to migrate and work overseas because of the pace and the benefits. There are not enough here that are being given to them in public and private hospitals. That's why we see them all over the world, basically managing a lot of the healthcare systems. Your unusual business model is now in 30 countries. Do you think that this will fit in the Philippine healthcare system, this neighborhood care?
Yes, I think what we see if you look at the vision of the World Health Organization, you see that community healthcare should be supported more and more. And community healthcare can give a lot of support to the healthcare in the community so that people don't need to go to hospitals. And in a lot of countries, it's already progressing. We see that the interest of a lot of European countries in the model is enormous. For example, Denmark wanted to implement the whole model in the whole country. We see that in Taiwan, the growth is increasing very fast. The prime minister in Taiwan said we have to focus on community healthcare because of the growing of the elderly population. So there are many reasons to focus on prevention and community healthcare.
And with elections in the Philippines, a crucial political exercise taking place this May 9, Jos, there's a crisis of trust in leadership in the country, from vaccine management to lockdowns and the climate crisis. In your view, what needs to change here?
Yes, I think it's an important topic that you mentioned. When I started with Buurtzorg, I said we need to build on trust. We need to find out how we can rebuild the systems or reform systems so that they are more based on trust, and that will have a positive impact on a lot of issues. If I look at education, if you look at also other things like the climate problems, I think we need more trust in society, but that starts with simple trusting each other and building systems which are based on trust.
Jos de Blok, the founder of Buurtzorg, joining us live from the Netherlands. Thank you so much for joining us on The Final Word.